Prenatal development, basically the prenatal period lasts from fertilization, when the egg is fertilized, all the way until birth. And that period lasts approximately 266 days. And within that period, you have three different periods in the prenatal period. That's the germinal period, the embryonic period, and the fetal period. So, the germinal period is the first 2 weeks after conception, and that's where the creation of the fertilized egg happens, and that's when it becomes the zygote, where we mentioned. That's when cell division occurs, and that's when the attachment of the zygote to the uterine wall happens. This is in the germinal period. In the germinal period, the blastocyte, which consists of an inner mass of cells, a lot of different cells in one, that will eventually develop into an embryo. And then implantation is the attachment of the zygote to the uterine wall, and that takes place about 10 to 14 days after conception. So the embryonic period is the next period, which occurs from 2 to 8 weeks after conception. And that's during this period, the rate of cell differentiation intensifies, and it begins as the blastocyte attaches to the uterine wall. Every body part eventually develops from these three layers: the endoderm, the ectoderm, and the mesoderm. The mass of cells is called an embryo, and the organogenesis is the process of organ formation during the first 2 months of prenatal development. Organs are especially vulnerable to environmental influences during the embryonic period. So an amnion is something that develops. It's a bag that contains a clear fluid in which the developing embryo floats inside of it. The umbilical cord contains 2 arteries and 1 vein and connects the baby to the placenta, and that's usually how the baby gets nourishment. The placenta consists of a disc-shaped group of tissues in which small blood vessels from the mother and the offspring intertwine, but they don't join. And usually after birth, that's when after a natural birth, vaginal birth, that's when the placenta comes out. So next is the fetal period, and that begins 2 months after conception, and it lasts for 7 months. This period is basically called the fetal period, and the fetus is about 3 inches long and weighs about 3 ounces 3 months after conception. By the end of the 5th month, the fetus is about 12 inches long and weighs close to a pound. And at birth, the average American baby weighs 7.5 pounds and is about 20 inches long. So that weight can range. It can be higher, it can be lower. I know when I was born, I was about, I think, 9 pounds. And babies who are less than 7.5 pounds or less than 7 pounds can be considered low birth weight babies. So there's 3 trimesters. There's the germinal and embryonic periods occur in the first trimester. The fetal period begins towards the end of the first trimester and continues through the second and third trimesters. So when babies are born, they have about 100 billion neurons. And the basic structure of the brain is assembled during the first 2 trimesters of a woman's pregnancy. The 3rd trimester and the first 2 years of postnatal life after birth are characterized by connectivity and functioning of neurons. The neural tube develops out of the ectoderm and forms at about 18 to 24 days after conception. Two birth defects that are related to the failure of the neurotube to close are anencephaly and spina bifida. And these can be prevented by proper prenatal care. Prenatal vitamins are very important for a pregnant woman. So there's different prenatal tests that can be conducted to find out whether an individual is at risk for developing certain um, birth defects or disorders. The maternal blood screen will basically identify pregnancies that have an elevated risk for birth defects like spina bifida and Down syndrome. The triple screen will measure 3 substances in the mother's blood, and if they find something to be abnormal, they'll do an ultrasound and then an amniocentesis. And what that is basically they stick a needle inside the abdominal wall and into the uterus to actually test the fetus. So some of the hazards to prenatal development is a teratogen, and that's any agent that can cause potentially a birth defect or negatively alter cognitive and behavioral outcomes. And these effects vary depending upon the genotype of the mother and the baby, as well as the amount and timing of exposure to the teratogen. And a teratogen can be anything from drugs, incompatible blood types, environmental pollutants like cigarette smoke or fog, some kind of smoke, infectious diseases, maternal stress. If a mother or father are over the age of 35, and basically they vary depending on each individual, as well as the timing of the exposure to the teratogens. So basically the effects of a teratogen vary with the developmental stage of the embryo. Systems or organs in the process of development are generally affected more than the completed organs and systems. So those when a baby is still developing in the very first time of right after conception is the most vulnerable time. And since the various organ systems begin and end their prenatal development at different times, their sensitivity to agents varies over time. The most vulnerable time being from 15 to 25 days after conception. For That's for the brain, and then for the eye, it's from 24 to 40 days after conception. That's the most vulnerable time. And then for the heart, it's from 20 to 40 days after conception. So it's interesting that the most vulnerable times for conception are usually around times that a lot of women don't really know that they're pregnant at that time. Individual teratogens influence specific developing tissue, which leads to particular patterns of developmental deviations. So, for example, German measles affects mainly the heart, the eyes, and the brain. And the drug thalidomide, which is an anti-nausea drug that was used in the 1960s, results in malformation of the limbs. And you probably see a lot of commercials will say, if you took this drug during pregnancy and your baby turned up with heart defects, please call blah blah blah. Basically, those are teratogens that a mother ingested during pregnancy. Both maternal and fetal genotypes can affect the developing organism's response to teratogenic agents and may play an important role in the appearance of abnormalities in offspring. Not all pregnant women who used thalidomide, though, or had German measles during early pregnancy produced infants with abnormalities. So you have to remember that each individual is different, and there are other factors that come into play when you're considering things like this. The physiological and pathological status of the mother will influence the action of a teratogen. So, if a mother's in very poor health, um, that might have a negative impact on her fetus. So, if she takes a teratogen and she has very poor health, then the chances of her baby developing a birth defect are higher. And not only will nutritional deficiencies themselves directly affect prenatal development, they also may intensify the adverse effects on the fetus of certain drugs ingested by the mother. And there's other maternal factors like obesity, high blood pressure, and liver dysfunction that may also increase the impact of damage by teratogens. So the level of teratogenic agent that will produce malformations in the offspring may show only mild signs of detrimental effects on the mother or none at all. Um, basically, the mother might not even know until after the baby is born. Radiation from x-rays, drugs, alcohol, dietary deficiencies may have no impact on the mother, but may cause very severe problems in the infant. So these are some of the hazards to prenatal development, and they include things like prescription drugs. So even if a a woman is prescribed something that she needs for whatever it is, maybe she has an infection, she's prescribed antibiotics. These can all have a negative um, impact on the fetus, on the child. So it's important that a woman discuss these things with her doctor. There's also psychoactive drugs that have impacts on the unborn fetus, and caffeine is actually considered a drug, and women are recommended to limit their intake of caffeine. Also, alcohol, it can cause fetal alcohol spectrum disorders. Um, nicotine, cocaine, methamphetamines, marijuana, and heroin. So incompatible blood types was one of the teratogenic effects that I mentioned, and basically that's a difference in blood groups. So um, someone might have a blood type of A, B, O, or an AB, and the combination of the different blood groups might have an impact. Then there's the environmental factors. So the incompatible blood types would be the biological aspect to it. Then the environmental factors would be the 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 environmental or the nature side of the argument. So we have nature and nurture, which is a common debate in human development. So we have the environmental hazards, and that includes toxic wastes. That can be anything from the use of fertilizers or pesticides, X-ray radiation, things like that. Then there's maternal diseases, and that can range from anything. If a mother has syphilis, some kind of a sexually transmitted infection, genital herpes, HIV, and AIDS. These can be passed on to the baby or can cause other problems with the child. Also, diabetes. So I've already stressed the importance of prenatal care. So prenatal care basically involves a defined schedule of visits to a doctor for medical care. They provide screenings for manageable conditions and treatable diseases. Um, that includes a comprehensive educational, social, and nutritional services. So they basically tell a pregnant woman um, what she should and shouldn't do, and what she should and shouldn't eat, what she should be doing and not doing. So there's also a new program called Centering Pregnancy, that's relationship centered and provides complete prenatal care in a group setting. So it has a very social component to it. Most lifespan textbooks will focus on prenatal development from the perspective of the developing baby, as opposed to from the mother's perspective. Pregnant women have a variety of experiences ranging from changes in their bodies to changes in their emotions. If women do not seek support during that time, these changes may be confusing, unexpected, or even scary. There are hundreds of conditions or symptoms that can occur for women during pregnancy. So these are just some of them. If you talk to a pregnant woman, you might get 100 more. So fatigue. This can be from a little tired to extremely worn out and fatigued. You'll often hear women complain of nausea. This is often called morning sickness. Some women experience nausea or vomiting on the morning, basically in the morning, or sometimes all day long. Even though it's called morning sickness, it can happen at any time of day or night. And that symptom can last from a few weeks to the entire pregnancy. Um, they'll experience frequent urination, so the urge to urinate more often. They'll experience breast tenderness with the increasing levels of hormones that causes tender breasts. Um, headaches and dizziness. Basically, there's circulatory changes that are happening in pregnancy, and that can cause these symptoms. Weight gain. Women usually gain an average of 25 to 30 pounds during a pregnancy. Back pain. The joints between a woman's pelvic bones soften and loosen to prepare for the baby passing through, and the center of gravity changes as the uterus enlarges. Thus, the body compensates with resulting back pain or strain. And that usually happens later on in the pregnancy. Then there's lower abdominal pain because their ligaments are stretching, and that can be painful. Some other symptoms can include anything from leg cramps, skin changes, darkening around the nipples and navel, belly button. Despite the many symptoms that may occur for some women, there are many exciting sensations and experiences that occur with pregnancy as well, including feeling the baby move, experiencing special food cravings or food aversions, being pampered by those around you, um, learning about your body, learning about your developing baby, and preparing for parenthood. So this is what the birthing process looks like. There's a few stages involved. Um, the first stage is where contractions occur, and that causes the woman's cervix to stretch and open. Then the second stage begins when the baby's head starts to move through the cervix. The third stage is after birth, and that's where the placenta, the umbilical cord, and other membranes are detached and expelled or released. In the US, 99% of births take place in hospitals. Um, there are other ways to give birth besides hospitals, but 99% of them take place there. There's different people that can assist a pregnant woman. One of them is a midwife, and these midwives are practiced throughout the world. 95% of the midwives who delivered babies in the U.S. were certified nurse midwives, so they're certified nurses. Um, and midwives are different than doulas in that a doula is more of an individual who cares for a pregnant woman emotionally, gives the pregnant woman educational support, usually during, before, and after the child is born. Usually, midwives have a nurse degree and doulas do not. Until the past 10 years or so, cesarean delivery, which is basically when the baby is removed from the mother's uterus through an incision made in her abdomen, that was only used in cases when the baby was in a breech position, and that's when the baby's buttocks rather than its head is the first part to emerge from the vagina. But today, however, more cesarean sections are performed in the United States than any other country in the world. The cesarean delivery rate jumped 7.5% from 2002 to 2004 in the United States, all the way to 29.1% of all births are through cesarean delivery. Um, Improvements in the ability to identify babies in distress earlier in the birth process may be one explanation for that. Practitioners are also utilizing cesarean procedures on the increasing number of obese and seriously overweight pregnant women in the United States. Other reasons can include the desire of many doctors to avoid even the slim chance of a malpractice claim if something goes wrong in the normal birthing process. And there's an even more controversial reason for the cesarean increase, and that's that doctors and mothers want to schedule the baby's birth to the hour and minute. The Apgar Scale is something that's used after the baby's born, and that's used to assess the health of newborns at 1 and 5 minutes after birth, and they're given a score or a reading, and that ranges from 0 to 2 on each of different 5 health signs, and that those health signs are heart rate, respiratory effort, muscle tone, body color, and reflex ability. So if an infant has a normal or good heart rate, they're given a score on the Apgar scale. So low birth weight babies will weigh less than 5.5 pounds at birth. Then very low birth weight babies will weigh under 3 pounds, and that's very. You might think that's very light, and they may not survive. And there are cases where babies are born even lower, and extremely low birth weight babies are under 2 pounds. And if they survive, that's it's great. Preterm babies are born before 3 weeks or more before full term, and then small for date babies are babies that have birth weight that's below normal when the length of the pregnancy is considered. So incidences of low birth weight varies considerably from country to country, and it's related to poverty, maternal health status, and maternal nutrition. More health and developmental problems than normal weight infants will occur. At any age, they're more likely to have a learning disability, more likely to experience ADHD or attention deficit hyperactivity disorder, or breathing problems like asthma. There's different methods for nurturing these low birth weight and preterm infants, and these have been shown to be highly effective. Kangaroo care is a way of holding an infant so that there's skin-to-skin contact for 2 to 3 hours per day over an extended time in early infancy. Massage therapy, that's a firm stroking with the palms of the hands 3 times per day for 15-minute periods. Then there's bonding, which is forming a connection, especially a physical bond between the parent and the newborn in the period shortly after birth. The postpartum period is the period after the baby's born, and that lasts for about 6 weeks. And until the mother's body has completely adjusted and returned to its near pre-pregnancy state. Um, and also, the uterus needs to return to its pre-pregnancy state as well. Different things can happen during that period. Baby blues can occur, and that's 2 to 3 days after birth. Many women might begin to feel depressed, anxious, or upset during that period. Um, they also might experience postpartum depression, and that's a little bit more severe than just baby blues, and that's a major depressive episode for about 4 weeks after delivery. Fathers also can undergo considerable adjustment in the postpartum period, even when they work away from home all day. So, for those of you that are interested in viewing some kind of movie that's related to this lecture and this chapter, you can find this movie at probably any local rental store. Immediate Family. It was filmed in 1989, starring Glenn Close, James Woods, and it's basically about a couple that was married 10 years and they're infertile. They turn to adoption. Through an agency, they meet a teenage single mother. They spend time together, eventually creating a bond, and she agrees to sign away custody to the couple. But things don't go exactly as planned, and they are emotionally tested, waiting for the young girl to do the right thing. And there's other movies that are a little bit more current that probably have similar plots, but this is just one that I can recommend to you if you are more if you like to put your chapter into a visual in a visual way and watch it in a movie. So that could be helpful or useful. Then we have some website suggestions that are related to the chapter, and there's quite a bit for this chapter. We have a website for preemies, a website for Apgar scoring, Behavior Genetics Association, a website for childbirth, children's disabilities, evolutionary psychology, fetal development, fertility, Down syndrome, genetic counselors, postpartum depression, teratology society, visible embryo. So those are all good resources and suggestions for you.